twizzle with me.
Everybody starting doing the twizzle. Everybody, if you're ready to sizzle, you twist a little and you twist a lot. And when you really get hot, that's the twizzle. Twizzle, twizzle.
Weeknights starting at 9/8 Central on MeTV.
Hello, I'm John Malos, and welcome to Connect with Me. On this Wednesday morning, it's Ask the Expert Day. We're going to talk to Dr. Belle Peralejo about allergies, about asthma, about everything under the sun. She's also brought some paraphernalia, some medications that you can look at. Call in 265-4331 if you have a medical problem, specifically if you have allergies or asthma. Back in a moment.
Tonight I want to discuss the importance of the television medium to the American people.
No doubt about it, it's your turn to ask the expert today on this Wednesday morning, and in our studio is Dr. Belle Peralejo. She works as a doctor at the Baz Allergy, Asthma and Sinus Center. They have 8 centers across the Central Valley. They have one in Fresno, they have one in Madera, Hanford, and Visalia. It is the allergy season, of course. It's autumn. The weather is constantly changing on us. The weather has gotten colder. And the big question is, once the weather changes, like now, it's changing, getting cooler, does that affect your allergies? Does your asthma get worse? We'll ask the doctor. She's here. Your phone calls are important, 265-4331. Let's go to the videotape, and I'll show you the Baz Allergy, Asthma and Sinus Center. The staff is on hand and ready and waiting. Dr. Belle Peralejo, there she is in the white coat in the front, standing next to Dr. Baz, our friend Dr. Baz. Now, Dr. Peralejo is an allergist. Her specialty is skin allergies. We'll talk to her, though, about all sorts of allergies, including can the allergies increase or worsen your asthma situation? The weather is changing, as I said. The center there that you're looking at, that they're located in right now, is the one at Northwest Fresno. That's where this video was taken. Dr. Baz and his staff standing and ready to, well, Dr. Peralejo is standing here waiting to take your phone calls at 265-4331. She was born in Alaska. She went to medical school in the Philippines. She did her residency in New Jersey and went to work for that man, Dr. Baz, some 5 years ago here in the city of Fresno. She's in our studio right now, and she is ready to take your questions. Our phone number here is 265-4331. We're talking asthma, we're talking allergies, we're talking eczema. If you have that, call in and ask your questions. She has some machines here. She has a spacer. She has an inhaler. We're talking asthma and allergies and all sorts of medications. Back with more of Connect with Me and Dr. Peralejo and your phone calls in just a moment.
Is taking care of laundry taking too much of your time? Have you become a missing mom? With a new fast, efficient washer and dryer from Ventura TV Video Appliance, you'll spend more of your day the way you want.
This Amana Super Capacity Washer Dryer Pair is now just $6.99, and this heavy-duty Maytag Super Capacity Washer Dryer Pair is only $8.99.
Don't spend your life on laundry. Upgrade today at Ventura TV Video Appliance and save.
As mentioned, we have Dr. Belle Peralejo right here in the house. Today, she is going to talk about allergies and asthma. She works at the Baz Allergy, Asthma and Sinus Center. Welcome to the show, Doctor.
Good morning, John.
Yeah, how's Dr. Baz doing?
He's doing very well. And I'm sorry he's not here, but he sent me over to answer the questions of anyone who's having some allergy problems.
We'd rather talk to you anyway.
Well, thank you for having me. It's great to be here, John.
Well, we had a phone call, but it went away. So, allergy season, the question that I had right at the top is, since the weather has changed, does that change what is going on within your body as far as allergies and asthma?
It definitely does.
How so?
Well, when we talk about allergies, we have seasonal allergies. Seasonal allergies means it could be worse during spring, summer, winter, and fall. We are now in the fall season. So the fall brings a lot of weeds. The weeds are in the air. If you look at our pollen count, the weeds are in the moderate range. So that's up in the air. Lots of people are suffering. Our clinic is very busy right now, I'm sorry to say. The poor allergy sufferers are coming in because of their asthma. The cold weather is getting their bronchioles all constricted and they're having trouble breathing. So we're a lot busier right now.
So the biggest problem in the autumn right now are the weeds.
Yes, it is. However, we have the grass out there still and still some trees. However,
Right.
the weeds, ragweed, that's right now very high in the
Want to
air.
get right to it? You brought some apparatus
I
here.
did,
Hold
yes.
that up to your camera and you can
Okay.
show. These are the bronchial tubes, right?
These are your bronchial tubes, and this is when you have a normal bronchial tube. It's
Yeah,
wide open. You can
right.
get air in. You're breathing well. But if you have asthma, you're seeing a lot of inflammation. See how thick the bronchioles
Is that
are here?
mucus in there?
There's a mucus in there. You don't want that plugging your airways.
So
You're
how do
gonna-
you get that out?
Well, you take some medications, and we'll talk about that probably later. There's
Right.
also constrictions, so you can't breathe. You're starting to cough. You're starting to wheeze. It could be triggered by the cold that you're saying, but it could be triggered by allergies, the pollen, your dog maybe. Do you have a dog, John?
Yeah, well, not yet.
Not
but-
yet, okay.
Or a cat.
A cat could cause it. Dust mite, mold. There are a lot of issues that could cause problems, and the poor air quality in the valley.
Is it mainly the air, or could it be other things that contribute, like you just said, a dog, a cat, whatever, a mold? Is it mostly the air in the valley that contributes to it? Is that the majority of it?
The air in the valley definitely contributes. We have allergies, though. Like I said, we have poor air quality. We have pollution. You have to look at the air quality every day and see how it's affecting your breathing. You have exercise causing it. So a lot of kids will have problems when they start playing, running, playing baseball, PE. So they have to have their inhaler with them and use it as needed.
All right, we've got a phone call. Good morning, you're on Connect with me with the doctor. How are you?
Yes, I'm fine.
Good. What's your question?
Yes, I have asthma that's caused from allergies. And what I was wondering, one person did tell me that if you got rid of the allergies or got them under control, the asthma would disappear. Is this true?
That is very true, actually. What happens is if you are triggered by your allergies, and you have a lot of people with allergic asthma, you do have to control the environment. By that, for example, if you have a cat or a dog or dust mite or even mold in your environment, or maybe you're allergic to pollen, you do have to control these in your environment by maybe taking allergy medicines or allergy shots or different types of things to control the allergies. However, you still have to get your asthma under control, and sometimes you do need inhalers for that as well. So the best thing to do is go to your doctor and have yourself evaluated. Is it really triggered by allergies, or is it pollution or smoke? Maybe you have a relative or a family member that smokes, and that could trigger it as well. However, if you do know you have allergies, then it's good to control the allergies with medications and
But
avoidance.
controlling the allergies will control your asthma.
It will control your asthma to a
Right.
certain degree.
All right, and I want to hold this up just one more time for the camera, just so you can see that real quick.
This,
now,
correct.
if your airwaves right here, if they get constricted,
Yes.
can it get so bad that you can die?
Yes, it can. Unfortunately, statistics have shown that even though we're trying to do a very good job at controlling asthma, 10 to 11 people still die across the United States because of asthma.
Because of asthma?
Yes. They could have mucus plugging that could really block the airways, or they could have very bad
Why
constriction.
do they die? Are they not controlling it, not taking the right medication, all of the above? What?
It could be all of the above. If they're not controlled with their asthma and they're not seeing their doctor or not using their medications properly, they could unfortunately die. But if they're going to their doctor, getting it under control, taking care of their allergies, avoiding their triggers, then they'll probably be under better
It's a
control.
lifetime thing? You're stuck with it if you have asthma? It's
It
a
is-
lifetime thing?
it is,
It's
unfortunately.
a life sentence, huh?
It is. They always have to have their rescue inhaler in case they have trouble. They may be controlled without what we call a maintenance medication, but they always have to have their rescue inhaler, which helps them with emergency problems.
Yeah, that's pretty amazing. I got some full screens I want to put up on the screen here.
Okay.
And we're going to take a look at some of the symptoms of asthma as we put that down. All right, that is from the Baz Allergy, Asthma and Sinus Center. If you have cough, hay fever, allergies, bronchitis, infections, you can kind of read the list. Let's keep it up there. What sticks out in your mind more than any other?
I would say the allergies in general, because there are a lot of symptoms that go with that. Runny nose, sneezing, congestion, trouble breathing. I also look at the wheezing, because a lot of parents will hear wheezing and they're wondering if their kids have asthma. I also look here at shortness of breath. Skin allergies I do love because I've done further
That's your
training.
specialty.
That is, and
Yeah.
a lot of people
Yeah, I
come
know.
for eczema and, hives and things like contact dermatitis.
Can the allergies cause the asthma?
Yes, yes. As a trigger for asthma, like I said, if you're allergic to your cat and there's a cat in the house, you could all of a sudden have bronchoconstriction.
But I mean, if you're going along in life and you don't have asthma, and all of a sudden you develop these allergies for some reason or other, that can cause you to develop asthma later on?
In general, when you do develop allergies and asthma, there is like a genetic predisposition. That means if your
Okay.
parents had asthma
Right.
and you're prone to getting allergies and whatnot, you may get asthma and even eczema. So that comes with like what we call an atopic march.
And your allergies obviously can cause a major headache. I know
Correct.
because I've had that before. I mean, my
Yes.
allergies can cause a bad sinus headache.
Correct. Lots of mucus could accumulate in your sinuses and cause a lot of headache. Yes,
Right.
correct.
Yeah, that's where you see a lot of sinus infections.
Oh, yes.
Yeah. Okay. Another phone call here for Dr. Belle Peralejo. Good morning. You're on Connect with Me. I was going to say good afternoon.
Good morning.
All right. What's your question?
Question is, I'm watching you, and you sit there and said that allergies can cause eczema, okay? And I've noticed that the eczema that I have is getting worse. Is there something I can do to help control it? Anything over the counter?
Well, there are many types of eczema. So what you want to do is make sure it is eczema because, your eczema could be, let's just say something else like a fungal infection. But let's say you do know you have eczema. It could be from contact dermatitis or contact with something like your soap, detergent, perfume, nickel, or it could be because of other allergies. Especially in kids, they do get eczema from things like, dust, their atopic background or allergic background, such as dust mite or cat and dog. There are things that you can buy over the counter. In general, if you're if we're sure that it is eczema, steroid creams do help as long as you use it properly. You can use what we call antihistamines to help with itch because usually itch does come with it. And then the important thing is to keep your skin well moisturized. If the skin is very dry, it becomes very itchy, becomes thick, and if you moisturize your skin, then that will help as well. But please do see your doctor to make sure it's the right thing that you're doing and you're not having side effects from these topical steroids because it could thin your skin. So if you're not sure about it, do see your doctor, but you can try things here and there, yes.
Okay.
Yeah.
We're going to take a break and
Okay.
come back with more of Dr. Belle Peralejo right here from the Baz Allergy, Asthma and Sinus Center here in Fresno. There are 8 locations up and down the valley. Your phone calls, very important. Continue to call in and ask those very important questions about asthma, allergies. 265-4331 is the number.
It's time to play the Hi Bob game. Simply watch the Bob.
Howard, I wanted to hear what that lady said.
As I was saying, simply watch the Bob Newhart show and count how many times people say Hi Bob.
Well, why don't we start things off?
Hi, Bob. Hi, Bob. Hi, Bob. Hi, Bob. Hi, Bob. Wakey, wakey, Aiken Basie.
Sorry, try again.
Darn it.
Everybody loves the Hi Bob game.
This is the greatest game I've ever seen.
Weeknights at 10:30, 9:30 Central on MeTV.
No doubt about it. Your turn to ask the expert today. 265-4331. Another phone call for the doctor in our house. Good morning. You're on Connect with Me. What's your question?
Good morning. I have allergies, and I've been taking stuff like Zyrtec and Claritin. Now I hear because of my age, I shouldn't take that. It affects your prostate. Then what can I take?
That's a great question. How old are you, by the way?
66.
Okay. That a prostate issue is a concern at that age.
Yes, it is. The thing about these antihistamines, they're pretty safe. Obviously, though, if you have any trouble with your liver or whatnot, you want to make sure that you're not overusing them. The problem, though, is if you have these Zyrtec and Claritin and whatnot with the Sudafed, that causes...
Can you use those with a prostate issue, though? That's the question.
I would not use the ones that have the D in it. The Zyrtec D. That could possibly affect your blood pressure and give you trouble with the prostate and trouble with urinating. In general, though, they're pretty safe. They could cause drowsiness and dryness. Make sure you're consulting with your doctor to make sure that there's no other interactions with other medicines.
So, for example, a Claritin D, the D stands for what? Decongestant?
It's a pseudoephedrine.
Okay.
A
the
decongestant,
pseudoephedrine.
correct.
So that could affect your prostate in terms of urination.
Correct.
And it could affect your blood pressure.
Yes, I
So-
would not use that long term unless you're under the care of a doctor. Just make sure that you're monitoring all these and there are no interactions with other medications or other illnesses. Some people do use it, so it's not contraindicated all the time. But if you do have issues with the prostate, I would not use the one with a D.
Okay, with the D. D like
correct.
a dog.
D with a
Okay.
dog,
D with a
Sudafed.
D,
Yes.
Yeah. So how many of these medications have a D at the end of it? It's Claritin D and what other ones?
Many of them have it. Even the generic ones could have the D at the end. Also, you can get it on its own, just Sudafed on its own. So it doesn't have to be the allergy medicines with these decongestants.
Can you get Sudafed without the D?
Yes, well, that's the D. You can take it without
Okay.
the antihistamine.
Okay.
And it's not necessarily a bad medicine as long as you use it, sparingly, infrequently, and when needed only.
Yeah, and I've heard that antihistamines, they dry you up.
They may, yes.
Can they dry up your other organs in your body?
They can dry up in general. For example, you may feel that you're dry in your throat or whatnot.
Okay.
So if you're feeling that, then maybe you have to back off on the medicine. But in general, it doesn't cause that much drying. There are some people, though, who are very sensitive, so they should.
There's never an easy answer.
There's never an easy
when
answer.
When it comes to medicine, there's never a clear defining line, is there? It's
That's
just
true. I mean, if
everybody's different. Too.
Everybody's different, right? So some people are very sensitive. Others can take so much of it. So.
Nothing is easy.
It's true.
It's so true. All right. I want to turn you around and show you a piece of video, and then we'll come back and test this machine. It'll be turning around to this side here, and we'll take a look. It's a breathing machine, and you blow out the candles, and you can take a look at the videotape for yourself and explain what we're looking at here, and then we'll do it right here live.
Okay, this is a spirometer, and we have a patient who's going to be tested for asthma. What she's doing is she's putting the mouthpiece in her mouth, breathing as hard as she can, and if she could do it for about 6 seconds, that would be the best. She has some candles to try to breathe,
She blew
blow
6
out.
out of 8.
That's pretty good.
Yeah.
And then what you need to do, though, is do it at least 3 times because we need what we call reproducibility. It cannot be very different from each other.
She got them all.
She got them all. She did a good job. So let's see what happens here.
Let's see if she does it
I
again.
think
We
they're
do have
happy.
a phone call.
Oh,
No?
okay.
No phone call. They went away.
Okay, they went away.
Call back, 265-4331. She's going to do it one more time.
She's doing one more
here.
time. This is the 3rd time.
Yeah.
She's trying as hard as she can. She's taking a breath back in.
All right,
Very
let's see
good.
what happens. Did all the oh, we didn't see if the candles went out, but that's okay. But you're supposed to do it 3 times.
At least 3 times.
Yeah, we'll turn you back around here.
Okay.
Yeah, that's fine. And so what's the purpose of that machine?
Well, what it does is it measures volume. It measures how much you're able to blow out from your lungs. And if you want to diagnose asthma, it's a gadget to use to try to diagnose asthma as well.
We're going to test it out. We have it
sure.
right here on the desk. However, we got to take this phone call first.
Okay.
Good morning. You're on Connect with me. How are you?
Doing good. Loving the show.
Great. What's your question?
Information is, a gentleman called earlier about eczema. Same thing here is, what would they suggest for something that, the allergy does cause eczema so bad that the skin is dry?
Does your skin bleed?
Yeah, because I scratch it and I'm trying to keep it moist like the doctor said. But, being on a limited income and not having the funds to go to a doctor like everybody else.
What are you using now? What kind of creams are you using to try to keep it moist?
A friend of mine gave me some stuff that he got from the VA, and it worked really good. And it was like you rub it in and it would go into your skin. It wasn't oily or greasy.
Right. Okay. Any advice, doctor?
Oh, definitely. There's a lot that you can use that are not very expensive. However, you'll be surprised that sometimes these creams are actually covered by your insurance if you do have insurance. The problem, though, is you need to use mild products. For example, things that are not scented, things that are not with a lot of color, because you may be sensitive to them. So things like White Dove unscented is good. Detergents that are hypoallergenic, shampoos that are hypoallergenic as well. Now, if you can use a emollient, those are moisturizers or lotions, that would help as well. However, if it's very inflamed, very itchy, very red, you may really need some medication on there. Just putting moisturizers may not help. That's where, seeing your doctor once, getting a prescription may not be that expensive. Going and, getting the right medication once, that would help you as well.
Yes or no answer, because we're out of time in this segment. But like say your hands are dry and they crack and they bleed during the winter. I heard if you put moisturizers on your hands at night and put gloves on, that will help keep the moisture in. Is that true?
That's true. You can put the gloves on to cause occlusion. It gets absorbed into the skin a little better. With caution, though, not too long. And faster, right.
Yeah. But you can wear the gloves overnight then.
You may if you're not sensitive to the gloves.
Okay, all right.
And put the moisturizer right after bathing. That's a good tip as well.
Yeah, because your pores are open, right?
Correct, and you have the moisture on there to trap it.
Okay, Dr. Belle Peralejo is here from the Baz Allergy, Asthma, Sinus Center right here in the city of Fresno. Back with more of your phone calls. 265-4331 is the number.
Ventura TV Appliance Center. We're the low-price leading brands reliable advice place. The Whirlpool Dream Kitchen Get Yours Today place. Check this out. Right now, get huge savings on select Whirlpool appliances and pay no interest when paid in full within 6 months. At the hometown low price, think outside the big box place. Since 1951, Ventura TV Appliance Center. We're working hard to be your place.
Now, we saw a few minutes ago that the lady on the video, she was actually blowing into the machine, and she was trying to blow those candles out onto the screen. We have that machine right here. If we can take a shot of that, just hold that up just briefly so people can see what it is.
We'll see some numbers there.
And there it is right there. We have a little monitor right there and some gadgets, and then you hit the start button. So I blow into this,
yes,
and I'm trying to blow out how many candles altogether?
As many as you can, as long as you...
There are 8
There
candles?
are 8 candles. If you can blow them all out, that's great.
Okay, and I got 3 shots at
Great
this,
effort,
right?
hopefully, yes.
Okay, let's see. Let's give it a shot.
Deep breath in and blow, 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 blow. Deep breath back in. You did 6.
I did 6.
Not bad, yeah.
Okay. All right. We got a phone call here. Let's try 2 more later.
Okay.
After the phone call. Good morning. You're on Connect with Me with the doctor. What's your question? Quickly.
Yes. I was wondering if ringworm is a form of an allergy, or can it be you're allergic to something, or how is that?
Ringworm, that's a simple question, actually. It is not an allergy. It is actually caused by a fungus. So you do have to put an antifungal cream on instead of a steroid cream, for example.
What is ringworm exactly?
Ringworm is caused by a fungus.
It's an actual worm.
Oh, no, it's not.
It's not. It's just called ringworm.
It looks like, because the borders of the rash...
It looks like a worm.
It looks like, correct.
But it's not a worm.
It's not a worm.
It's a fungal.
It's a fungal infection,
Okay.
correct. So it's totally different from allergies.
Yeah, okay. All right. Any other questions? Or okay, he's gone. Okay, good answer. I appreciate your advice here. Want to try this one more time?
Oh, yeah, let's do it again. Let's put it on start as hard as you can. Try to
Okay.
blow out all the candles. Blow, 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 and suck back in.
I got 6 again.
One thing you want to try, though, is to put the mouthpiece behind the teeth and a nice tight seal around this and blow as
Okay.
hard as you can.
Okay,
Oh,
try it
one
again.
more. Let's put it
Okay,
on start.
All right, one more time.
See how you do. And go. Blow, 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 blow. Suck back in.
How
And you
many did I
got
get?
6 again.
6
so
again.
Not bad,
Okay.
John.
The purpose of this is to show what does the doctor get out of this machine?
Eventually, what you'll have here is a printout of numbers. It will have percentages. It will tell me how well you breathe compared to another gentleman, your age and height and weight and everything.
So it tells you something about the lungs?
It will tell me eventually if you have some obstruction or blockage in your lungs.
It will?
Yes.
What are you getting from my breathing? Any
Unfortunately,
blockage?
what I want to do is do the second set of testing where we give a bronchodilator and then test you again to see if you improve. But just by looking at this, you did pretty well. Yeah.
So by the looks of it, from the naked eye,
wow.
not too much blockage, right?
Not at all. You're in the 100+ range, 100+%.
Really?
You did very well. Yeah. You probably
That's
have healthy.
good to know.
Are you wheezing or coughing, John? Maybe we should.
No,
I
don't know. You know, I'm superstitious, so knock on wood.
Okay. No, that's not what we're
No, I don't think this is wood.
Oh, it's not wood. You're
no,
right.
but this is wood right here. Anyway, we got a phone call. Good morning. You're on the air with the doctor.
Good morning.
What's your question?
Hi. Are you there?
Yeah, go ahead. What's your question? Quickly. We're almost out of time.
Sometimes I go outside and I get something in my throat that causes me to eventually, like, wheeze and get a reaction. And one time it even stopped my breathing.
Oh.
And I was wondering what that might be. And it felt like an insect. So maybe you could tell me, and I'll hang up and listen on the TV.
Thank you.
Okay, bye.
Not sure about that insect comment because she thought that because there was a thought that outside there's trouble with inhaling something. I would suspect possibly pollen. You know, that's what's outside. Other people have trouble when they're exposed to odors like perfumes, fumes, smoke. That could cause you to have problems with breathing. The very important thing is to know what your triggers are, because
More than likely, if it was outside, it was something in the air.
Correct.
Probably pollen, right?
Well, we say pollen, mold is also outdoors. You also have things like, pollution, smoke, the particulate matter, diesel particles. There's odors from, exhaust.
But if you're wheezing like this gentleman was, and it was in his throat and then he couldn't breathe, that's a serious matter.
Yes, it is.
Call 911?
Yes, they may have to do that. If they know they have asthma and they have an inhaler, that's the time to use it. Their rescue inhaler.
A rescue inhaler, which is like a Pro Air inhaler?
Correct. Albuterol, Levalbuterol. Pro Air is a example of that. There's Proventil, Ventolin, and Xopenex. If they have those inhalers, they should use it. But yes, go see a doctor, because if they're having constriction and having trouble breathing, then that is serious.
And if they call the ambulance, probably a dumb question, but if they call the ambulance, they have all this medication
Yes, they
on
do.
board,
They have
right?
oxygen. They'll have the nebulizer if needed.
They'll have everything on
Correct.
there.
If they needed an EpiPen, because let's say it was actually an insect sting, now that's a different thing. If it was a bee sting and they had trouble breathing, they have to have what we call an epinephrine injection.
That's like an EpiPen?
Correct. If they're given an EpiPen in general, they can use that on themselves if they were stung and allergic to a bee, but they have to call 911 and see the doctor.
All right, we got about 3 minutes. You also have a spacer and
I do have a
an
spacer,
inhaler. Why don't you
yes.
bring that over here so we can see it
So a lot of,
clearly?
If the patient
Okay.
is given an inhaler such as this.
Yeah, we'll hold it up there to the
Okay.
camera.
Oh.
Yeah.
And
Now this is the inhaler.
This is the inhaler or puffer. A lot of times the kids cannot coordinate pressing, and this is just placebo, but so
Right.
you'll see something come out. They cannot coordinate, for example, inhaling and getting the medicine into their lungs.
All right, now what's this for?
So a lot of the kids especially will have this device, which is called a spacer or aero chamber. This is an example of it. They'll put the inhaler in the back here. After
Okay.
shaking it a couple of times, they'll put it in the back. They will actually spray the inhaler into this device.
Into the spacer.
Correct, and I'll pretend that I'm here. This is where they'll take an inhalation. They breathe out.
Why is that better than just using the inhaler?
You have to coordinate if you're going to put this in your mouth, or you put the inhaler a few inches away from your mouth. With this, though, you're able to wait like a second, and the medicine gets in here so that you can get the medicine better into your lungs, and it does not lodge in your throat and your tongue. You don't want it in your tongue. It's not going to work there. So you want it to get into your lungs well. So if you breathe out, take a deep breath in, you'll be able to get the medicine better. And for the little ones, there are masks available for
So
this.
the spacer helps get the medicine into your lungs.
Yes, it does.
Much easier.
Correct.
Much better. Much more effective. Is that
Yes.
the purpose of the spacer?
Yes, it is. It's
Okay.
not a necessity for everybody, but especially for kids who cannot take the inhaler properly, it is encouraged.
Right. Is the spacer recommended more for kids than, say, senior citizens?
Senior citizens may need it as well. Sometimes they're not able to coordinate also, and those who are prone to getting what we call a fungal infection in the throat, such as thrush, they may need to use it as well, because it helps to prevent it from staying in the throat.
Let me ask you a question that I talk to, or I have people ask me all the time, or not ask me, but we kind of talk about it. Do you think that we live in a society that there are so many people out there, so many medications? Are we an over-medicated society to a certain extent? Do
Yes.
we rely on these medications too much, or do we really need them?
Well, a lot
Is that
of
a fair
things.
question?
It is a fair question, definitely. A lot of things is prevention.
Yeah.
That's the main issue that we as allergists want to deal with. Prevent your allergies. Try to, if you're really allergic to that cat, keep it out of the bedroom. But there are times that you definitely need medicine. In terms of asthma, please have your rescue inhaler with you.
Yeah.
In terms of bad allergies, as a precaution, have your antihistamine if you're having bad allergies. Prevention, though, could be through what we call immunotherapy, wherein
Right.
we give allergy shots to help patients deal with their allergies better.
Right.
So
Just
prevention
don't get lax.
Don't get lax, please.
Yeah, don't get lax, because you could get into trouble.
Yes.
If you get lazy, right?
Yes, sometimes you do need those medicines.
Yeah,
definitely.
so you're feeling good, and then all of a sudden you feel, I don't need this, I don't need that, and then you get into trouble.
Correct.
Doctor,
Oh,
thank you very
John,
much.
it was
You
great
did
being
a
here.
Great job.
Oh, thanks for having me.
Thanks for the information. Dr. Belle
I hope I helped.
Peralejo. Yeah, come back again.
Okay.
We'd love to have you. Thank
I'd
you
love
for
to
the
come.
information. That's going to do it for today on Connect with Me. We're back tomorrow. And you know who's here? Becky Cinema. We'll talk about movies. See you then.
Do you like me?
Just like me.
Like Me TV Fresno on Facebook. Get the latest news, interact with others, watch videos, become a fan of me. Exclusively brought to you by Ventura TV.